Yeah, good morning, students. Today we are going to discuss lecture number 24. The topic is diabetes mellitus, important topic, and everybody knows that what is diabetes. It is a condition where the glucose levels in the blood is increased. So it is a chronic metabolic disorder. It is not a disease, but it is a disorder in the metabolism of the glucose. So that's why it is called as chronic metabolic disorder. And it is characterized by hyperglycemia, that is increased blood glucose level, and it is just due to the decrease or deficiency of insulin. That is the one reason. And second reason is because of defective response of tissues to insulin. Means you have insulin, but the tissues is not responding it correctly. Classification, that is the types of diabetes mellitus. It is mainly two types, primary and secondary. Primary is the one which is also called as idiopathic, whose cause is not known clearly, where secondary diabetes mellitus cause is known. In this primary diabetes mellitus, we have mainly two types, and that is called as type 1 diabetes mellitus and type 2 diabetes mellitus. Type 1 is also called as insulin dependent, in short form IDDM, that is insulin dependent diabetes mellitus. And this is also called as juvenile onset diabetes mellitus because it happens in young age, less than 35 years of age. Type 2 diabetes mellitus is also known as non-insulin dependent diabetes mellitus, that is an IDDM, non-insulin dependent diabetes mellitus. It is also called as maturity onset diabetes mellitus because it happens in the age above 40 years. Secondary diabetes mellitus is due to identifiable causes like pancreatitis, that is the inflammation of pancreas, and because of some endocrine disorder where there are some hormonal imbalance is there. And this secondary diabetes mellitus gets corrected and reversed when primary disorder is controlled. Now there is some important difference between type 1 and type 2. In exam, you have to write like this only, column wise, type 1 and type 2, and these are the features. So the first feature is frequency, means the chances of occurrence of type 1 diabetes mellitus is 10 to 20%. Type 2 is 80 to 90%. So most of the patient with diabetes mellitus is having this type 2. Age of the onset, type 1 it take place below the 35 years of age, whereas type 2 take place more than 40 years of age. Type of onset, it is abrupt, suddenly, and it's severe, whereas type 2 is take place slowly, gradual, and insidious. Insidious means gradual but very harmful. That is the meaning of insidious. Weight, here type 1 it happens in normal weight people, whereas type 2 it take place in obese people. Next feature is human leukocyte antigen, HLA. These are the antigens which are present on human leukocyte, which decides the histocompatibility. Means that if some foreign others body cell is transplanting into recipient, then it is the HLA which is going to decide whether it should be accepted or not. And this HLA is having some region which is divided into HLA DR3, HLA DR4, and HLA DQ. These are the three regions present on these genes on chromosome number 6. Whereas there is no HLA association with type 2 diabetes mellitus. Family history, if you see type 1 family history is found to be less than 20%, whereas in type 2 it is approximately 60% of family history is found. Genetic locus of this HLA is mainly present on chromosome number 6, where it is unknown for type 2. Diabetes in identical twins, if you see, the probability of type 1 is 50%, whereas the probability of type 2 in twins is 80%. So more is probability for type 2. But main is pathogenesis and mechanism of type 1 and type 2. So the main point to remember in type 1 is it is because of autoimmune destruction of beta cell. It means that your own immune system is going to identify your pancreas beta cell as a foreign substance and produced auto antibodies and destroy that beta cells, and no because of that no insulin will be produced and you'll get type 1 diabetes mellitus. Whereas for type 2 the main reason is the insulin resistance, impaired insulin secretion, means your body pancreas is producing normal insulin level, but your tissue becomes ineffective, means when insulin is coming and binding to the insulin receptor present on the cell, it is not able to open the GLUT transport, and because of that glucose is not able to go inside and it is not being utilized, so we say that it become resistance. Then isolates of cell antibodies which destroy beta cell is present in type 1, whereas there is no role of antibodies in type 2. Blood insulin level, if you see in type 1, it is of course decreased because of the damage of beta cell, whereas there is no damage of beta cell in type 2, so there will be a normal or even increased insulin level, but it is not able to open the GLUT transport in the cell. Then isolate cell changes, of course insulin cell depletion. Here there is no insulitis, there is no inflammation of beta cell. Later there is a formation of fibers nearby the beta cell, that is later fibrosis. Amyloidosis is infrequent in type 1, whereas it is common in chronic. What is amyloidosis? Amyloidosis is nothing but it is the deposition of amyloid proteins. Amyloid protein is also called as bad protein, whose structure is changed and the function is also changed. So that is called as amyloidosis. Clinical management, so how you can manage the type 1, for that you have to depend upon the external supply of insulin, as well as you have to do some diet. Then type 2, you have to, along with diet management, you have to do the exercise, and mainly you have to depend upon the medicines, that is called as oral hypoglycemic drugs. In some cases insulin is also taken. The main complications of type 1 is called as ketoacidosis, whereas the type 2 the main complication is called as hyperosmolar coma. So ketoacidosis, what is ketoacidosis? It is a condition in diabetes, the adipose tissues fats utilizations, that is lipolysis increases, which cause more fatty acid production, and this fatty acid, when it goes to the liver, it converted into ketone bodies, that is called as acetoacetic acid, and that is called as ketoacid, which increase the acidity of blood and cause ketoacidosis. That is the type 1 complication, whereas type 2 complication is hyperosmolar coma. What is hyperosmolar coma? It is a condition including hyperglycemia, that severe hyperglycemia, there is more concentration of blood glucose level, and hyperosmolality, means the concentration of solute is more than the water, and dehydration. So this is the three characteristic of hyperosmolar coma. Now apart from this, you can add some more differences, or you can write the differences in this format also. So whichever you understand and easy for you, you can write. So in one notes I have given this difference: type 1 diabetes mellitus, type 1 and type 2. It is also known as insulin dependent diabetes mellitus or juvenile onset diabetes mellitus, whereas type 2 is called as non-insulin diabetes mellitus, and it is also called as maturity onset diabetes. Origin, it is a viral origin most of the time, that is because of a special kind of virus called enterovirus, whereas the origin is hereditary origin, and it is because of some gene mutation. If you see the patient body build here, the patient is lean in appearance, they have lost the weight, The main reason for loss of weight in type 1 diabetes is for energy. They start utilizing the fats, and fat utilization increases for the production of energy. That's why the type 1 patients lose the weight, whereas in type 2 the patient is obese. The patient obese. Some etiological difference between the type 2 and type 1 diabetes mellitus are: type 1, there is beta cells of pancreas are destroyed because of, you can say, autoimmunity, whereas beta cell of pancreas is not destroyed, but it produces normal insulin, but the insulin action is inappropriate. The action, insulin is not able to produce its action. On what is the action of insulin? That it goes bind to the insulin receptor present on the cell and open the GLUT transporter through which glucose enter into the cell and undergo for glycolysis, and that way glucose utilized. Insulin is there, it is going and binding to the insulin receptor, but that receptor become insensitive and it is not able to open the GLUT. That's why the glucose is not being utilized. In second, the patient lacks the insulin hormone which controls glucose and maintain blood sugar levels, whereas in type 2 it develops when the body become resistant to insulin. This is a very important point for type 2. Insulin is an anabolic hormone which converts glucose to glycogen. That's why glucose utilized, then some amino acids to protein and fatty acids to triglycerides. Whereas in type 2, the cause of type 2 diabetes mellitus include genetic factors, obesity, high calorie intake, insulin abnormalities, and increased fat breakdown, then defective hormonal secretion in intestines. So these are the some etiology which leads to type 2 diabetes mellitus. In type 1, there is a total lack of insulin, and we know that it leads to ketoacidosis, that is more ketone bodies in blood, which increase the acidity of blood. In type 2 diabetes mellitus is due to inadequate insulin secretion in response to demand. Hence, type 1 diabetes mellitus is due to the complete deficiency of insulin secretion, as there is a destruction of beta cells of pancreas because of the condition called autoimmunity. And what is autoimmunity? It is the condition where your own immune system has identified the beta cell as foreign substance and produced autoantibodies and damage it. Some characteristic feature difference between type 1 and type 2 is in type 2 there is a decreased insulin secretion. In type 2 there is increased glucagon secretion. Glucagon is the hormone secreted by the alpha cell of pancreas, which increase the blood glucose level, whereas insulin is secreted by the beta cell of pancreas. Some common difference between the symptoms of type 1 and type 2. 3P, that is polyuria, polyphagia and polydipsia. Polyuria means there is a frequent urination, there is more passes of urine. Then second is polyphagia, means excess hunger. Then polydipsia means excess thirst. So this is three important symptoms of diabetes which belongs to type 1 also, type 2 also: polyuria, polyphagia, polydipsia. Polyuria means frequent urination, polyphagia means excess hunger, and polydipsia means excess thirst. Then there will be a fatigue, weight loss, then weakness. In this there will be loss of weight, slow healing of wounds. Then next symptoms for type 1 is ketonemia, that is ketone bodies in the blood. Then ketonuria, that is more ketone bodies in the urine. Agiuturia means excess urea in urine. and there will be impaired growth because there is a lack of insulin hormone. Then there will be poor wound healing. So we know that diabetes patients, their wound heals very slowly. Chances of infection is more in type 1. More glucose level, that is called hyperglycemia, hyperlipemia, more lipid levels, and glucose yeah, that is the more glucose in urine. Whereas in type 2, this is still type 1 continuation, and this is type 2. There will be dry, itchy skin, tingling or numbness in feet or hands, blurred vision. Then ketosis does not occur. Ketosis is the main feature of type 1, but not the type 2. Then therapy wise, if you see, then in type 1 mainly we have to depend upon the insulin injection, that is the external supply of insulin. Whereas for type 2, we mainly depend upon the different types of anti-diabetic drugs or oral hypoglycemic agents. That is oral hypoglycemic agents like metformin, biginoids, various type of sulfonylureas. These are the drugs used for the type 2 on diabetes mellitus. Now the next part is a pathogenesis, which is very important. That is pathogenesis. First we'll discuss the pathogenesis of type 1 diabetes mellitus. And for pathogenesis of type 1 diabetes mellitus, I prefer this flow chart. That is pathogenesis of type 1 diabetes mellitus, which we start from autoantigens. What is autoantigens? Autoantigens are nothing but it is your own body cell components that is identified as a foreign substance by your own immune systems. So it may be beta cell, any component of the beta cells which has been recognized as autoantigens by your own immune system because of some genetic and environmental factors. So this leads to once your immune system has identified any of the component of beta cell of pancreas, then this will lead to the activation of your immune system, that is called as helper T cell. We know that our immune system is having two important cell, that is B cell and T cell. T cell is again of two types, helper T cell and cytotoxic T cell. So these helper T cells get activated because of the autoantigen, and this helper T cell is going to release kind of chemicals. That chemical is also known as chemical mediators of inflammation, that various types we have already discussed in the chapter called inflammation. So there is a release of cytokines. What is cytokines? These are the chemical mediators of inflammations. As for example, interleukin 2 and interferon gamma. So when these chemicals release, then it acts on that autoantigens, that your own cells, that is beta cells, and cause the inflammation of beta cells of islets of Langerhans of pancreas. And we know that whenever inflammation happens, we use the term TIS, anything. So insulitis means here the inflammation of beta cell is taking place, and we know that beta cells release insulin. So that's why we use the word insulitis. That is the inflammation of beta cell, and when it happens, it can lead to the death of beta cell or damage of the beta cell. And this is the point. This is the reason of type 1 diabetes mellitus. So main thing in type 1 diabetes mellitus we have to remember is how the damage of beta cell is going to take place, and it is most of the time it is your immune system which is identifying beta cell as foreign substance, also called as autoantigens. And against these autoantigens, now your immune system start working, and they are activating the helper T cells, and the helper T cell is releasing some chemical mediators of inflammation, and these chemicals is acting on beta cell and causing their inflammation, and finally cause the death of beta cells or damage, and that leads to type 1 diabetes mellitus. So in exam, if it comes, then for type 1 diabetes mellitus, these flowcharts you can prefer. Whereas for type 2 diabetes mellitus pathogenesis, you can prefer this flowchart. That is, it start because of genetic factors and because of constitutional factors. Genetic factor is related with the genes, and constitutional factor is related with your lifestyle, your way of living. In genetic factors, you have tried that probability in identical twins to get type 2 diabetes mellitus is 80%, and if both the parents are diabetic, then there are 50% risk to the child to get type 2 diabetes mellitus. Whereas constitutional factor, if you see on if the person is obese, if it is person is having hypertension, and if it is having low physical activity, then this genetic factors is going to cause decreased insulin secretion and cause decreased amylin. Then it causes glucose toxicity of isolates. Then it causes lipotoxicity. What is amylin? Amylin is a hormone secreted with insulin, which inhibits glucagon secretion. Whereas glucose toxicity of isolates is irreversible beta cell damage due to the high glucose concentration. And what is lipotoxicity? It is the liver dysfunction due to the accumulation of lipids. Then insulin resistance. This is the main keywords in the pathogenesis of type 2 diabetes mellitus. And in this, insulin resistance take place because of receptor and post-receptor defects. So what is the receptor? It is nothing but it is the glycoproteins present on the surface of the cell on which the molecule insulin comes and bind on the insulin receptors, and there is a signal change inside the cell which leads to opening of a transporter that is called as glucose transporter from the cytoplasm. It comes and bind to the cytoplasm cell membrane, and by which the glucose gets inside the cell, and it undergo for a process called glycolysis. That's why glucose utilized. So when there is a defect in receptor and post-receptor signal, then it causes impaired glucose utilizations, and this all leads to increased hepatic glucose synthesis. So there is more liver synthesizing more glucose, and this, so synthesis is more but utilization is not there. So this keeps on increasing the blood glucose levels, that is leads to hyperglycemia, and this generally happens because of the insulin resistance, where the blood your insulin production is normal but it is become resistance. The tissue cells are not responding the insulin, they are not able to open, the blood glucose is not going inside and not getting utilized. So because of this particular word insulin resistance, it is a type 2 diabetes mellitus. So if in exam, if this question comes, then diabetes mellitus, you can start with the definition, then types. In types, generally type 1 and type 2 diabetes mellitus, and in some books they have given some more types where they have mentioned about gestational diabetes that happens in the pregnant women, where the blood glucose level increase suddenly in third trimester. That is called gestational diabetes. Whereas there's some book where they have given the type that is called as drug-induced diabetes, where some of the drugs, the side effect is increased blood glucose level. So those are called as drug-induced diabetes mellitus. But mainly you have to write about the type 1 and type 2. Better you write in the columnar forms and write mostly about the etiology and symptoms. Then you can finish this topic by drawing the flow charts for type 1 diabetes mellitus and type 2 diabetes mellitus. But the keywords you have to remember in type 1 diabetes mellitus is because of beta cell damage, whereas in type 2 the keywords is because of insulin resistance. Thank you so much.